Well, November is National Hospice Month, and we need to learn more about this kind of care. And joining us today, Hospice Medical Director at Mercy Health St. Rita's, Dr. Amy Metzmaker. And thanks for coming today.
Hello.
All right, so first of all, let's just give us a definition of hospice. What does that mean?
All right. So hospice is care for someone in the last phase of a terminal illness so that they can continue to live as well as they can. And I think that it's focused on their life. It's not so much just focused on their death now. And the other big thing about hospice is it's care for both the patient and the family. So whereas typical medicine, it's the patient, we look at the patient and family as a unit because we're trying to get the family through this as well.
Right, yeah, it's kind of like two sides to it, right? That, you know, both need the care, and that's where you guys come in and you're able to help?
Yes.
All right, so what makes, Mercy Health Hospice kind of different maybe than from other hospice programs?
I think we have a couple of things. Number one is we actually have 2 board-certified hospice and palliative medicine doctors. So I'm an internist that's been subspecialized in hospice for over 20 years, and our other doctor is a family practice doctor. So because of that, we take care of older and actually also younger people. So we actually have pediatric patients. Plus we have this hospital partnership, and St. Rita's is completely dedicated to taking care of people from birth, maternity care even before birth until, until the end and through death. And they have great resources that they commit to us in order to do that.
We always think about, there's changes in technology for surgeons and for doctors and things like that, but hospice has gone through changes too. Tell us about that.
Yep. So we practice what I really call modern hospice. So I think that 20, 30, 40 years ago, hospice was just about the death. And now there's so much more that we can do to take care of people. Number one is we've integrated doctors actually into the mix, whereas it used to be just hospice nurses. And now what we've figured out is that since it's about that last 6 months of life, our focus can be more on helping people do as well as they can for as long as they can, instead of just about the death. So we may have somebody who is, with heart failure and they're getting IV Lasix at home. So, previously they had to go to the hospital for that. Well, we can do it at home. Or somebody with a malignancy that's spread in their abdomen and intermittently they can't keep things down. Well, we can actually do IV fluid at home and help them to feel better and do better longer. So I think that the focus on doing some things that can also be life prolonging is a huge part of that modernization.
Right, yeah. First thing that comes to my head when you talk about prolonging, how long the former President Carter was in hospice. Everybody's like, oh, he's hanging out. But I guess that's an example of how you can prolong and he can stay home and, you can help a patient.
Yes, if you continue to take good care of people and adjust their meds for their diabetes and their blood pressure and their heart failure and treat some infections and things like that, people can actually do better longer.
Right, yeah. Oh, well, Doctor, I think you've kind of opened up people's eyes to have a different look at what hospice is all about. And so this month, I assume raising awareness about this is part of your plan, right?
Yes, absolutely.
All right, very good. Well, thanks for coming today.
You're very welcome.
All right, don't go away. New Edition continues with a look at the weather forecast.